All right, the attendees numbers has started to slow down, so we'll get started. Just so everybody knows, this is being recorded. We will share the slides and the recording at some point after this. I'd like to welcome everybody to the second StARS Learning Collaborative. Today, we're going to have an opportunity to hear about the NIA Data Linkage Program, which is a resource that will be available, or that is available for StARS grant applicants. So before we get into that, I just want to provide a few introductory remarks. My name is Eric Jugwitz. I co-lead the data core of StARS with Callie Thomas. The data core is here to support applicants in thinking through how they can link their different data sets together and also help applicants think about how they can share their data. Both of the data sharing and data linking are core features of the StARS program. Katie, I might have to have you advance the slides because the button is slow on my end. The StARS Learning Collaborative, supported by NIA through a U Award. We're thankful for our NIA colleagues, NIH colleagues. Just note that the content is the responsibility of us as the authors and doesn't represent the official views of NIH. Slide, please. So StARS as a broader center, our main objective is to facilitate state-based research on dementia care programs, whether it's coordination, integration of services across different service providers in the state. And to do that, we want to support states in combining different data sets to be able to evaluate these programs when historically it may have been challenging to do so. Slides. So before we get started, a few housekeeping notes. We'll address all questions at the end. You can use the Q&A feature on Zoom. I think chat also works. Follow-up questions can be submitted to StARS. You see the email here. Again, these slides will be shared after the presentation as well as the webinar. And I believe the linkage program, if you have questions specific to linkage that don't sort of overlap with StARS, you can reach out to Susan and her team as well, and she'll probably have contact information there. Slide, please. So why are we interested in linking and sharing data? The key here is we want to link data to facilitate a more comprehensive understanding of program impacts and return on investments. And specifically for StARS, we're interested in programs that support people with dementia and or their caregivers. We want to encourage folks who are interested in the StARS grant mechanism to think about linking 2 or more data sets. They can be at any level, but the linkage should be appropriate for sort of the question at hand. And so you could think about linking 2 different data sets at the person level. You could think about linking data at the person to provider level, at the person to geographic level, at a provider to geographic level. But the linkage has to be appropriate for the question at hand. And we really want to support folks who are linking data sets that have historically been challenging to combine under existing structures. Slide, please. So for StARS and the funding mechanisms that we have in place, there's 2 sort of general data requirements. The first is linking data, and we kind of talked about that. We really want to support folks in linking data through systems that have, again, historically been hard to merge or connect. The other requirement for StARS and the data piece is sharing data. And so here we have just some examples of the different types of sharing and linkages, as well as what would be what the reviewers are looking for in terms of how they're thinking about sort of a more favorable or less favorable approach to the data linking and sharing. Linkage, the NIA linkage program is not required for StARS grant applicants, but it is a resource we want to make folks aware of because it helps with not only the data linking piece, but the data sharing piece. And so it provides a nice sort of package that grant applicants can take advantage of at no cost, I believe. And so the purpose of today's talk, again, is to just make folks aware of the linkage program, help you start to think about how you could use this for any StARS applicant you're thinking about. Slide, please. So here's just an example of how linkage could be used for a StARS project. A StARS applicant, for example, uses a data platform to track clients, recipients of dementia care services. Using linkage, the project could link the platform data to CMS claims data to better understand how participants in receiving dementia care services in the states, their healthcare utilization patterns before versus after participating in the program. This is just one example of how you might be able to use linkage to start asking and hopefully answering some questions about your dementia care programs. Slide. So with this introduction, I'd like to pass it off to Susan, who is the project director of the NIA Data Linkage Program. She'll go through sort of the linkage program at large. Again, questions can be put in the Q&A feature of Zoom, and we'll have an opportunity at the end of this to go through them and answer them. Susan, off to you.
Thanks, Eric. Good morning to everyone, and thank you for allowing Irim and myself to join you today to provide a brief overview of the NIA Data Linkage Program. We're hoping that this is just the beginning of a great partnership, not only between the State Alzheimer's Resource Center, but also your team and the Linkage Program. Katie, oh, there we go. Just a quick agenda we'll go through. The plan for our time with you this morning is to provide just a little bit more of an introduction to both Irim and myself, followed by an overview of the NIA Data Linkage Program. Next, we'll talk about the free CMS data resources that are available. I'll take some time to go over a few research examples and then discuss the support resources that we have available, and of course, entertain any questions that you may have at the end of the session. By way of introduction, I'm Susan Siford. I'm the program director for the NIA Data Linkage Program. I've been with the linkage, I'm actually a contractor that has been awarded the NIA Data Linkage Program contract. And I've been with the contract for a little over 5 years, and I'm supported by a dedicated team that provides comprehensive knowledge, not only of the linkage program itself, but also the use of CMS data in research. I'm joined today by Irim Azam from National Institute on Aging. As our contracting officer representative, Irim provides us endless support to the linkage program and is dedicated to working with teams such as yourselves to ensure that you receive the services and data you require to execute your research and monitoring needs. Now for a brief overview of the linkage program. NIA established the linkage program to address 3 major challenges that researchers face relative to gaining access to the CMS data for linkage to their study participants. The first challenge is the time and cost that researchers have to take to access the CMS data resources. To overcome this, NIA collaborated with CMS to structure this program in a way that is able to provide quicker access to CMS data without the researcher incurring any additional data fees. One condition of the program, however, is that researchers must use the CMS linked data in a federally authorized system that complies with the federal data security requirements. Finally, NIA recognizes that not all researchers are experts in the use of claims data. The linkage program offers knowledgeable support staff that have worked with CMS data on a variety of different research topics, and they're all available to assist researchers. It is important to note that the linkage team views our work as a partnership between researchers, NIA, and the StARS group. Our primary goal is to provide not only the CMS data to link your registry or group participants, but also provide you the necessary support to achieve your research goals. Our team prides itself in its comprehensive onboarding and operational support, while NIA provides not only the program support, but also the review and approval for the use of CMS data that your team would like to use for research. Sorry, the slides are not responding quickly. There's a four-step process for joining the NIA Data Linkage Program. The first step involves completing an NIA DUA, followed by developing a CMS masking technique workbook, followed by onboarding to the linkage enclave, and finally conducting the linkage with your study group, your studies participants. I will take each of these steps individually to describe a bit more. The first step is preparing and submitting the NIA DUA. To do so, your team will be asked to complete an application process, which includes the completion of several forms. The first is the project information form, which is a description of your intended research that includes your research goals. The second form is the data request form, which includes the selection of available CMS data that will be used for your intended research. This form will require justification for the use of each data type and the years of data requested. The next form is the data sharing protocol form, and this is related to the NIA as part of NIH's emphasis on transparency and replication in research. And this is to ensure scientific rigor and promote the efficient use of resources. This commitment is reflected in the data management and sharing policy, which went into effect in January of 2023, that requires all NIA-funded researchers, including those at NIA, to submit a data management and sharing plan with their funding application. As part of the linkage program, we use this data sharing policy to determine how quickly data will be made available to outside researchers. The intention of this is to ensure not only sound practices in managing sensitive data, but also open up the evaluation of your research for reproducibility purposes and research integrity. Finally, one other component of the DUA packet is the need for an institutional review board approval. And this approval must include the mention of use of CMS data connected with your study or registry participant data, as well as outlining the intended research. The final step is to execute the NIA DUA agreement, which outlines the roles and responsibilities for use of the CMS data, as well as some legal terms regarding the data ownership and data use. Upon receipt of the DUA application materials, the linkage team will conduct a preliminary review of all the documents to ensure that the package is complete and that the justifications for data are applicable based on the intended research. This step may involve some back and forth between your team and the linkage team to complete the finalized package. However, once the finalized package is completed, the package is then submitted to the NIA Privacy Board for review. The NIA Privacy Board is made up of experienced NIA program officers that review all data use agreement requests from researchers. This group meets weekly and makes determinations on if a project is eligible for the linkage program based on feasibility, minimum data necessary, and security requirements. The linkage team prides itself on its DUA application process. If desired, our team will offer at-elbow assistance to make sure that the DUA package is completed effectively. Our team has realized great results in this area, often gaining approval to access the CMS data from the NIA Privacy Board within 2 to 4 weeks of application submission. The next step in the onboarding process is the development of the CMS data variable masking. The linkage program holds the privacy of your study and registry participants in highest regard. Operating under the premise that any time 2 or more de-identified data sets are combined, the amount of data available increases the risk for re-identifications of the individuals within the data set. While this may not be of concern to your immediate study team, given their knowledge of the study or registry participants, it becomes vitally important as data is made accessible to researchers outside your team. The CMS variable masking workbook provides the opportunity to mask or blank variables that may lead to re-identification of the individuals, whether it be the individual study participant or the individual providers that are providing services. For example, all claims data provide the Medicare beneficiary identifier for all beneficiaries included in the data set. To overcome this, the linkage team creates a random beneficiary ID that is then crosswalked back to your participant identifier so that those 2 data sets can be merged without revealing any of the Medicare identifier information. Similarly, on the provider side, the claims include MPI numbers for providers, which in turn can be connected with detailed provider information such as name, address, and other information, simply by using a publicly available MPI lookup engine. The linkage team will work with your team to either drop this variable or create a random NPI-like string so that the provider level trends can be researched without revealing the actual provider information. The linkage team has developed a 4-level masking workbook with suggested masking techniques that can be used as a basis for your team to develop your specific masking levels. Once completed, this workbook will be applied to the data extraction that is completed after the linkage linkage process occurs. This may result in 1 to 4 different data extractions that can be used to and be delineated to the appropriate researcher based on their research. The next onboarding step is the introduction to the linkage enclave. The linkage enclave is different from your typical remote access desktop in that it meets over 300 federal data security measures that are required to achieve a moderate level authority to operate. The linkage enclave currently operates under 2 authority to operate. One is issued by the Centers for Medicare and Medicaid Services, which allows the linkage team to store and allocate access to CMS data. The second is an authority to operate granted by the National Institute on Aging, which grants permission to store NIA-funded study data and CMS data to be used for purposes of NIH-funded research. The consequence of meeting these federal data security measures is that this desktop workspace has much tighter administrative controls than what you're used to on typical remote access desktops. For instance, the project desktops within the enclave do not have access to the internet. And this is to ensure that there's no inappropriate access to the enclave by unauthorized users, and also prevents the downloading of any programs from being introduced into our system without appropriate security assessments. The enclave is a set of secure, segregated workspaces that are designed as such to ensure that there are appropriate firewalls established for data use and management. The first workspace that you'll see here that involves the data linkage, this is where the linkage team and the study team interact for purposes of linking your data to CMS data. This is the only space within our enclave that you will provide protected data such as PII or PHI that is required to link your participants to CMS data. I'll discuss the linkage process next. However, it is important to note that this environment is firewalled from all other study sites purposely to keep inadvertent disclosure of any protected information from going out. So there's limited file transfer capabilities into and out of this system. Once the linkage process is completed, the protected information that your study team has provided to the linkage team is destroyed, and we provide you with a certificate of destruction. The second space is the study management and analysis space, and this is where the study will upload their study participant data. Please note this space is managed solely by the study. Neither NIA nor the linkage team have access to this workspace. Studies typically import their data and create a folder structure that makes the most sense for allocation of the data to various research teams. The last space, which is the researcher data analytics space, is an environment where the study will allocate the appropriate data cut that they want the researcher to have access to. The linkage team will allocate the CMS data based on their approved DUA. And this is where the team can work within this environment to complete their analysis. Within the project environment, the researchers have access to a variety of statistical analytic software packages. We offer free of charge MATLAB, Python, R, SAS, SPSS, and STATA. We also offer what we've developed and called the job board. The job board is a series of high-capacity servers that are dedicated solely to running programs from each of the major statistical packages, which include Python, R, SAS, and STATA. To allow researchers and studies to transfer data in and out of the enclave, we offer what we call the File Auditing and Security Tool, which we often refer to as FAST. And that's used to import data into the enclave and export aggregate level results from the enclave. This tool has a three-pronged approach to review all file transfers. The first is an automated algorithm that looks for executable file types and common formats of the protected information, like the 9-digit format for Social Security numbers, the MPI strings. And this is intentional, so those files would be automatically rejected and not allowed to leave the enclave. The second and third prongs of this approach require review by your study. So your study may have developed study-specific guidelines for what is allowed to be exported into and out of the enclave. And then review of the linkage by the linkage team that focuses solely on the CMS data components of the file transfer. We're looking for small cells, any types of formats that could be misconstrued or are actual protected information level data, beneficiary level data. NIA has recently established a comprehensive set of disclosure review guidelines that are available online at the NIA Data Linkage website. But we also offer this document within the enclave for easy reference when researchers are preparing files for transfer. The last step of this the four-step process to join the linkage program is to actually conduct the data linkage. I previously mentioned that the protected information required to complete the linkage to CMS gets uploaded into a certain environment within the enclave. This is used, the Finder file typically contains information like the full name, any type of administrative IDs, whether it be the Medicare or Medicaid identifier or the Social Security number, age, gender, address, and any other health information that may be able to help assist in narrowing down that particular participant in the beneficiary enrollment file. We'll provide you with Finder file guideline instructions that will have you prepare this information into a common format in a CSV file that can be uploaded to our enclave and then read programmatically in to our programmatic algorithm that produces the linkage results. The next slide goes over the free CMS data resources that are available through the linkage program. We have the Medicare enrollment data, which originally was the denominator file, which transitioned over to the master beneficiary summary file at about 1999. We have the Medicare Parts A and B claims data for the fee-for-service beneficiaries. We have the Medicare Part C data for those that are participating in the managed care program. We have the Medicare Part D data, which provides the prescription drug events for those beneficiaries that have enrolled in the Part D program. We also provide Medicare assessment data, which includes the MDS from nursing homes, the OASIS tool from home health, and the IRF-PI data from the inpatient rehab facilities. We also provide access to Medicaid data, initially from the MAX data, transitioning over between 2014 and 2015 over to the TMSIS TAF files. Now to go through just a few research examples for the group. Please note that these research examples can be tailored to any of the outcome trials that you would like to work on. These are just examples, and many of them can be tailored to your individual group's areas of interest, whether you're completing health outcome studies, health trajectory analyses, or effectiveness trials for areas such as home-based care programs or more targeted drug therapies. So the first example is to look at study participants with an Alzheimer's diagnosis to see what the key healthcare consequences are from a hospitalization. So you would narrow down the CMS population. And of course, this is an Alzheimer's resource group, so you're going to have all Alzheimer's folks enrolled. You'll look at the current care setting, whether it be a home health care or inpatient rehab facility or a skilled nursing facility. Look at the presence of comorbidities, and then do a time series analysis that would look at how each of those comorbidities change with each of the care settings that the patient or the beneficiary transcends through. In another example, you may want to look at the statistical differences among different groups of individuals based on demographic or socioeconomic, behavioral, or genetic characteristics, looking at outcomes, disease severity, or underdiagnosis of Alzheimer's disease. And this just goes through narrowing it down from your long-term care cohort, looking at the difference of health outcomes, the percentage broken out by the underdiagnosis of those groups, and differences in the disease severity. And then doing a time series analysis on utilization of services and payments to determine what that actual impact is. I'm a pharmacist by training, so of course I have to add a drug sample into this, one of the examples. And this is to look at the whether one of the Alzheimer's drugs demonstrates significant improvement in cognitive decline compared to traditional therapies. And this is to use the assessment data to gain your baseline cognitive status and functional assessment, and then follow this over a period of time to look at the cognitive decline based on the intervention, the drug intervention therapy, and do a time series analysis using the assessment data and the claims data to see how that patient progresses over time. And finally, the use of CMS data is especially helpful for capturing the health trajectory. And looking at your patient's journey over time, and even to breaking it down into different segments of the population, like rural patients or patients with multiple comorbidities, patients with early onset Alzheimer's disease or late onset Alzheimer's disease, and looking and comparing preventative care, hospital care, when they've transitioned into the nursing home, how many times they go from the nursing home into the hospital, and then eventually to death. So it's a great resource to do health trajectory analysis, and we see that done quite frequently using the CMS data. As far as support resources go, Acumen, the NIA Data Linkage Program staff will support you through the entire journey of the onboarding process, from the NIA DUA process, scheduling as many ad hoc technical calls as needed, providing assistance either through email or through our dedicated service desk line. I've provided the contact information today. Our typical hours of operation are Monday through Friday, 8 a.m. to 8 p.m. We do have staff that cover both the East Coast through the West Coast, so we do have extended hours, often exceeding these hours. And we're always available to help in any way possible. And now we'll open this up to any questions you may have.
Susan, I'll read off a few of the questions in the chat, but then also encourage folks to keep putting stuff in the Q&A and/or going off. I think you can go off mute and ask your question. So one of the questions, Susan Irim, is there any minimum number of study participants to use linkage?
This time there's not. The lower number of study participants does present challenges with regard to data sharing, because of the power of the power of analysis. But we've had groups that have enrolled as little as 50, to groups that have enrolled. We have one group that has over 3.5 million participants. So there's really a wide range of how many participants that we're willing to do linkage. Obviously, the linkage of smaller groups is much quicker and occurs much faster, but you deal with some data sharing issues with regard to that, especially if they're located within one geographic area.
Cool, thank you. We have a question here about kind of the masking process and who can and can't see the data. I think you may have covered this, but it might be good to hear it again from you. So the question reads, so the data will be masked at our level and invisible to the linkage program overall, or is the data masked when sent out to researchers and still known to linkage?
Once we destroyed the finder file, obviously we could trace it back using the CMS enrollment file, but once we produce that, we destroy the protected information and don't go back and try to retrace those individuals. We do the linkage and then we turn the data over to the study. As far as the masking level, so we have 4 levels of masking. We have an internal level, which we grant access to, which is the least masked version of the data. That goes to the study. So the group that's actually providing the protected information, and they get access to that data to do their analyses. As other external researchers request to use the data, it is really up to the individual group, the state group, to then dictate which level of masking each researcher will get. We have 3: standard, which is the most restrictive. It strips all the geographic variables with the exception of the ZIP3, all of the beneficiary IDs except for the age, and all of the provider information. Then we move to a geographic version, which will expand the zip from a ZIP3 to a ZIP5, and allow some more detailed geographic variations. Given that this is being done for the most part at a state level, we don't envision that a lot of the geographic variables would want to be released because it does significantly increase the risk for re-identification. And then we have a provider level that is the least encrypted, but not as least as the study version of the encryption. And that provides some provider variables. Like I said, we can strip the MPI and create an MPI string for trending analysis. But the provider variable provides a little bit more detail with regard to provider services beyond physicians, like actual individual institutions, whether it be nursing home or hospitals or home health agencies. It provides a bit more information with regard to that. But the selection of which masking level of the CMS data really falls to the state and what their comfort level is and what their permissions are to share that information with external researchers.
Thanks. Yeah, so I just want to reiterate that this is one of the key requirements for submitting a StARS grant is the data sharing, and the flexibility that linkage provides is really nice in helping facilitate those requirements and housing that data moving forward for other people to use in the future as you dictate what level of sharing you're comfortable with. So it's a really nice benefit of linkage. One of the questions that came up in the chat we responded to, but just want to reiterate. The question read, I thought that a requirement of the grant is that we share data with the linkage program. Can you clarify? Thanks. Again, a requirement of StARS grants, you do some sort of data linkage and you do data sharing. You do not have to use the NIA linkage program, although it is a very helpful, as you've heard today, resource that's available to you and something that you can consider using. But using NIA linkage is not a requirement of the grant itself. It gets a little confusing that the term linkage is used a couple of different ways. As we're talking about it as like the name of this program and also sort of the process of combining data, but I hope that clarifies. Susan, you talked about the data that is sort of available from the CMS side of things that to be linked. We have a question in the chat that reads, can we see a preview of what the data charts that fall within these data sets look like, as in which variables we should see? Yeah, it might be helpful again to comment on those data sets where people can learn more about them.
Yeah, so we have an online data dictionary that's available temporarily on the linkage website, but we've created what we call a docs portal, which is where all the documentation that will be submitted for the DUA. Within that docs portal, we have the availability of the data dictionaries of all the variables that are available within each of the Medicare and Medicaid data sets. So they would describe the variables and give you a bit more information on those to help you determine which sets of data are most appropriate for your research.
Okay, yeah, and for folks who aren't aware, you can also learn more about CMS data products at ResDec. Also has some helpful information on variables and sort of the response options and whatnot. We had another question come up in the chat. You responded to it, but just in case people haven't seen it, the question read, is linkage free to NIA funded studies that are already completed or only to actively funded projects? Do you want to just comment, Irim, for folks who didn't see the actual
Sure.
response?
Sure. So NIA studies that were previously linked by the linkage program and have ended may join to receive program services. However, studies that have ended and did not receive a linkage in the past through this program can't join to receive data linkage services for their existing, for their unlinked data sets, unless they receive another NIA grant. If there's a research team out there who would like to access an existing linked data set, including the StARS data set, they can join as a researcher.
Cool, thank you. Another question that was asked in the chat Q&A is support offered for completing NIA GUA forms. For StARS applicants, I think there's two levels of support here. One is if you're going through linkage, linkage can help with some of that, as well as the data core can help you think through some of those issues. So if you're going through the StARS sort of program, you have two levels of support for thinking about various DUA forms, either requesting data or establishing your own DUA forms for sharing data. If you're not going through StARS linkage, the linkage program has their own mechanism in place that can also help facilitate that. I'm seeing we're getting through, or we got through most of the questions. Let's see, two new ones popped in. Are there other types of data available other than Alzheimer's, dementia, and other related disorders? I'm guessing this question was related, Susan, to your example of a sort of data pool query. So you might just want to comment sort of how what variables you could pull from to define populations.
To define the population, we use the enrollment database largely to pull the beneficiaries that are appropriate for the research that's being done. There are other statistical publicly available data sets that are allowed to be imported into the enclave as well that can help assist in that assessment. Does that kind of drive it what the question was intended? We have many other participants in the linkage program that can be found on the NIA Data Linkage Program's website that also offer their study data, their participant data that's been linked with CMS data as well.
Yeah, I think that gets at it. Just to reiterate based on that question, StARS is focused on the sort of ADRD dementia population. So that was the example given. Certainly, if you have questions that fall outside of dementia care, that is not going to be relevant. Probably not relevant for StARS, but there's definitely other funding mechanisms out there and other tools you can use to study those populations. All right, next question. Are researchers able to use linkage as a tool outside of NIA projects? I think we've answered this, but linkage is a, well, I'll let you go. You're typing it up. Maybe you can just.
Sure. I just want to add that the program is going to be available to support additional federally sponsored projects at NIH. And so we're going to, again, primarily focus on supporting studies that are seeking to link their data with CMS data.
Cool. The questions are slowing down in the Q&A. I think we've answered most of them. Susan, any sort of last words or thoughts that you want to share with folks about the linkage program in general and how to think about linkage in relation to the StARS grants. Irim, I'll give it to you first.
Well, thank you, Susan and Eric and team for your time to present today and for this opportunity to speak with all of you. I just primarily wanted to acknowledge the work that you've done to support the StARS team's participation. We think this is a great opportunity to use the linkage program and certainly invite you to do so. Over to you, Susan.
We look forward to working with you. We're happy to answer any questions that you may have as you start to develop your research question to determine the feasibility of how the CMS data could be used in your research. And we're happy to assist you all the way through the process of onboarding.
Cool. Yeah. Thank you, Susan and Irim, for presenting on the linkage program today. Thank you for all the work you've done in creating this as a really helpful resource. For StARS applicants, again, key things to keep in mind here. Linkage, using the NIA linkage program is not a requirement, but it's, again, a really helpful resource that you can take advantage of. The requirements from the grants perspective through StARS are data linking of some kind and data sharing. And again, the NIA linkage program is one tool mechanism to help you achieve that. It has a lot of nice features that sort of come out of the box and a lot of support, not only from the StARS data core, but the bigger NIA linkage team that can help with that. We'll make the slides again available after this, as well as the recording. If there are questions specific to StARS grants, you can reach out to the email you see here on the screen. If you have questions about sort of NIA linkage as a program and not specific to StARS, Susan and her team's contact information is on the slides as well. So we'd like to thank everybody again for coming to our second Learning Collaborative webinar. Really appreciate your time. We'll give you back 10 minutes, probably till your next meeting. Have a great day. Bye.